And to those joining in person and online, welcome. My name is Colleen Swain, and I am the Women's Leadership Development Associate with Mercy International Association, Mercy Global Action. And today I will be your moderator for Rebecca Rathbone's presentation. As you know, this series of presentations is a culmination of the work of the past 18 months. And it's a very exciting opportunity for all of the Mercy Global Action emerging leaders to share their research presentations, their passions, and conversation with all of you today. This is the 5th of 9 presentations, and we're very pleased to see participants from across the world, both online and in person. So thank you so much for tuning in. And before we begin, we just have some housekeeping for our Zoom participants in particular. This meeting has been selected, or this Zoom has been selected as a meeting rather than a webinar. So this allows the presenter and attendees to see each other. And you may choose to view today's research presentation with presenter view rather than gallery view. This allows you to see the presenter rather than all the attendees. And this option can be selected in the top right-hand corner of your screen. And of course, this session is being recorded for future viewing on the Mercy World website. And of course, for those joining in person and online, feel free to submit any questions or put anything in the chat box, and hopefully we'll be able to get to it at the end of our session. We'll have about 10 minutes for a question and answer period. So I have our first presentation for this afternoon. We'll explore the challenge of providing psychological first aid and humanitarian responses that take place in contexts where mental health is considered a taboo subject. Rebecca will dive into how psychological first aid provides an entry point for community members to actively participate in humanitarian responses, empowering community members to be mental health first responders in an effective way to provide this intervention to more people. So I now have the immense pleasure and the honor of introducing Rebecca Rathbone. Rebecca Rathbone is from Hamilton, Canada, and she currently lives in Rome and works for Caritas Internationalis as their officer promoting youth partnership or leadership. In this role, she develops strategies and programs that both empower young people to participate fully in the mission of Caritas and accompany Caritas member organizations to effectively include youth in their work. Prior to this, she worked for Development and Peace, Caritas Canada, for 6 years, during which she worked happily and closely with the Sisters of Mercy in Newfoundland to bring development and peace's education, advocacy, and fundraising programs to the province. While an initial introduction to the Mercy world, it remains an important formative experience to this day. Rebecca has a Master's of Global Affairs degree from the Monk School of Global Affairs and Public Policy at the University of Toronto. She's also the co-editor of the new book, Generation Laudato Si, Catholic Youth on Living Out an Eco-Spirituality, which gives a platform to young people from over 20 countries to share how Laudato Si has inspired them to care for our common home. I now have the pleasure to give the floor over to Rebecca. Much, Colleen. Is this okay? Yeah. Well, hi everyone. I'd like to start by saying a big thank you to all of you for your interest in our projects, and I'm happy to share mine with you, but most of all, I'm so proud that my work will get to be counted among the other smart, inspiring, creative projects of these that we are today. So what is my project? As Colleen said, my area of focus is providing mental health support to people in the wake of a disaster event in contexts where mental health is considered a taboo subject. I should say from the outset that I am not a psychologist,
and I have had no formal education in psychology. But it is a topic that I'm interested in, and I used the opportunity of doing this project to learn more about it, which was a journey, as you'll see. My background is in global affairs, and my career is in the field of humanitarian aid and international development. And so that's the background that has formed most of my thinking and my motivation for this project. So in short, what I've created is a reflection guide that is meant to, first, prepare community members and community leaders to provide effective psychological first aid in an emergency response after a disaster event. And number two, to help these people to reflect on and assess their performance and well-being as a mental health first responder. The goal? To help to bring even basic mental health treatment into communities that resist it by channeling it through key trusted members of the community. The strategy is twofold. Number one, providing formal training in psychological first aid to key community members gives them the skills to provide effective mental health interventions to people who need it. And number two, channeling this mental health intervention through key community members makes it non-threatening and increases access to community members. The end result, hopefully, effective mental health interventions that are delivered to more people who generally experience barriers to mental health care. And before I present the guide itself to you, I'd like to take a few minutes to share why it's relevant, hopefully useful, and how it came to be. So first of all, why is it relevant to the mercy world? Well, first, with respect to displacement of peoples and degradation of Earth, the broad themes of this fellowship, humanitarian responses are closely tied to both of these topics. For example, the UNHCR reported that in 2022, 32.6 million people were displaced due to disasters alone. We know as well, of course, that climate change is causing more and more extreme weather events, many of which require a humanitarian response. This guide, then, would be something that could help more people access mental health treatment in the wake of humanitarian responses that respond to the situation, among others, of course. Second, the guide is a form of meeting people where they're at. The goal isn't to convert people to believe in mental health or to knock taboos about mental health. That's important, but it's not the point here. The point here is to provide even basic mental health treatment to those who acutely need it in a non-threatening way. And third, it promotes the community-based support that was so central to Catherine McCauley's vision of mercy. This guide is a resource that helps to put mental health treatment into the hands of community members. And in the process, it helps to foster a sense of responsibility for people to care for the psychological well-being of other members of their community. So with all of this in mind, I hope that as you learn about the guide, you'll consider whether it could be something helpful to you in your own context of mercy. And if it's the case that you find it useful, then I will be very happy. Second, from a humanitarian standpoint, why is this guide relevant? What need does it fill? Well, to explain this, I want to share 2 points that are true and one conundrum that these points create when you put them next to each other. The 2 true points are this. Number one, mental health interventions are becoming more and more of a focus of humanitarian responses. Now, all of the biggest humanitarian organizations, the UN, the Red Cross, MSF, Caritas, all integrated into their humanitarian response programs in a very prominent way. This is because we know now that disaster survivors are extremely likely to be impacted psychologically by their experience, and that on average 15 to 25% of them will require mental health intervention of some kind. It was actually the response to Hurricane Katrina in 2005 in the United States that proved the importance not only of incorporating mental health services immediately into humanitarian efforts, but also of empowering community members to play an active role in this. This practice of providing community-based psychological first aid has since been applied in many, many humanitarian responses, including Typhoon Haiyan in 2012. Number 2, today, most large-scale humanitarian responses take place in the global south. This is because trends like poor infrastructure, poor health outcomes, and low social security make the effects of a disaster more acutely felt and felt for a longer time in the global south. And these countries don't have the capacity to respond to and build back from disasters by themselves. And now the conundrum. In the global south, and in many other places, but very commonly in the global south, it's typical for mental health and mental health treatment to be considered taboo and unacceptable topics. So how can we reconcile this? This was the challenge that I started with. So I want to briefly explain the journey I took to get to this final product, because this background information will explain why this reflection guide could be useful and effective. So the challenge I started with was, how can we provide widespread, effective mental health treatment to people who have experienced a disaster event in concepts where mental health is a taboo concept? Inspired by Catholic social teaching and Catherine McCauley's belief in empowering communities, I thought from the start that I had the solution. I would create some sort of guide that would help community leaders to translate healthcare-approved psychotherapeutic interventions and strategies into their own language. Now by this, I don't mean from English to French, for example, but rather from healthcare language to common cultural or religious language. To get from point A to point B, I started by researching the types of mental health interventions that are most commonly used in emergency contexts in general, not just in places where mental health is not widely accepted. Because to me, the most important part of this question is this: providing widespread, effective mental health treatment to people. So I wanted to know what professionals are doing when they don't have constraints to working use. In this stage of my research, what I'm now putting as a wonky wandering line because there was a lot to wade through, I came across the concept that was new to me of psychological first aid. I'll explain the principles of psychological first aid, or PFA, in just a minute. But for now, it's enough to say that psychological first aid serves the same purpose as the physical first aid that we're probably all way more familiar with. It's a first response to assess and stabilize surface level wounds. Only with psychological first aid, we're talking about surface level psychological wounds rather than cuts, scrapes, or bruises. So this is people's immediate acute responses and reactions to disaster events. As soon as I learned about it, I knew I had my focus. I was Archimedes, and it was my eureka. Why? Because it's at this point, at the beginning of the mental health treatment spectrum, that most people can be trained. Again, think of the physical first aid analogy. How many of you, just a show of hands, have ever taken a first aid course? Feel free to raise your hands. And how many of you are doctors and nurses? One. I had Dr. Schneider would be my doctor. But it's the same with psychological first aid. Anyone can be trained to be a mental health first responder, in the same way that anyone can be trained to be a physical health first responder. Then, sometimes you have to call an ambulance. And in the same way, in some cases, people will need to be referred to mental health professionals for longer term treatment. But other times, because you cleaned a cut or scrape as soon as it happened, the wound doesn't get infected and cause bigger problems. And that's the same with psychological first aid too. Sometimes when you stabilize psychological trauma right away, it eliminates the risk that it will turn into something worse or more complicated later. This is what I had sought out from the beginning, turning mental health treatment into a community-based practice as a way to reach more people and treat them effectively. So I thought, great, I'll make a guide that will help community leaders to translate a PFA first response into their own language. So I dove into learning about PFA. I took an online course created by Dr. George Eberly at Johns Hopkins University. I read articles and books, and the more I learned about PFA, it became very clear to me that my idea was not good. Why? Well, much to my discouragement, PFA and its principles sounded perfect to me as they were. I didn't think that my idea of translating it would add any value. In fact, I thought it would actually detract from it. And to explain why, I'll quickly explain the principles of PFA. The principles are summarized using the acronym RAPID, and hence this is called the RAPID model. The first involves building rapport and using reflective listening. At this first stage, the goal is to earn their survivors' trust, and make them comfortable enough to share with us what they need. We should never come in with a preconceived notion of what we think they should do. This requires compassion and careful listening, more than talking. Next, assessment. Based on what they share, here we determine the level and severity of their distress, which is not a formal diagnosis, but rather sorting out who needs what type of assistance. Then prioritization. This is the concept of triage. Here we make a hierarchy to assign help to people based on the level of urgency of each person's distress. And this could mean referring them to mental health professionals if possible. Next, intervention. Here we guide people to strategies that can help to take the edge off of their distress and help them to move towards recovery. And finally, disposition and follow-up. Here we make a plan to help them get back to a healthy level of functioning. So why would translating PFA take away from its effectiveness rather than add to it? Well, the most important feature of PFA is that it takes a survivor-led approach. It's all about listening to the survivor and taking all of your cues from what they share. I worried that making a guide to translate PFA into one's own language would actually make people too focused on what they themselves were saying rather than what the victims were saying. So I went back to the drawing board, so to speak, which wasn't completely blank, but was rather filled with information I didn't know before. And the one shortcoming of the online course that I took and the literature that I read on it was that none of them seemed to address the last part of my question. In contexts where mental health is a taboo concept. Everywhere in the literature, PFA and mental health were talked about as concepts that could be discussed openly. But we know that this is not always the case everywhere around the world. My question became then, how can we put effective PFA, as it is, as a survivor-first listening-based practice, into the hands of community members who live in places where they can't talk openly about mental health? I thought about this for a long time and finally concluded that rather than creating a translation guide for community leaders, it would be helpful to make a reflection guide for them. The purpose of this guide is to help the person providing the PFA in a context where they should not be providing it, to get into the headspace of being both a mental health first responder and a priest, an imam, a sister, a chief, in equal parts. I really believe that this is important and can provide good results if it's used properly. And this is for two main reasons. Number one, balancing these two identities allows effective mental health treatment to come into communities in a non-threatening way. In contexts where mental health is a taboo subject, if people assume the profile mostly of a mental health first responder, they won't be able to access people. Conversely, if they try to provide mental health treatment from only the perspective of, for example, their training as a sister or a priest, they won't provide effective psychological first aid. They have to be able to be both, and these reflections guide them into that mental state. And number two, it guides people to favor the survivor-led, reflective listening approach, rather than to project solutions from their personal biases. And this is a hard wire to redirect, because generally people want to help, and to a lot of us, helping is solving. This would especially be tempting for people who consider themselves to be leaders. So it's important then to help people to be aware of this temptation and fight the urge, and instead to help people discover for themselves what they need through reflective listening. And these reflection questions are meant to help them not just to accept this, but to truly believe that this is the right thing to do based on a reflection on their own values. So to bring the journey to a close, what always stayed the same was my conviction that community members can and should play a key role in helping people to process the trauma of a disaster event. But what changed was the methodology I found was best to do this, and where I felt I could add something novel and, most importantly, useful. So let's have a look at the guide then. The guide itself is meant to be an accompanying piece to formal PFA training, not a standalone resource or something that would qualify someone by itself to provide PFA to others. So by the time someone uses this guide, they should have already done formal training in PFA. The guide also provides suggestions about where to access this training. And the guide is divided into 2 parts with 5 questions each. 5 questions to prepare oneself before providing PFA to someone, and 5 questions to reflect on their effectiveness and experience of providing psychological first aid. So let's have a look then. The very first thing that the guide asks you to do is to name a key piece of your identity or your function in the community. This is where you would write something like a city council member or a rabbi or a teacher. But since so many of us are here from the Mercy world, let's use that as an example. So as I show you these questions, we'll answer them as a member of the Mercy world. This could be a sister, an associate, a partner, anyone who considers themselves a successor of Catherine and a person of mercy. So let's start with the 5 questions to prepare. The first question asks, why is being a mental health first responder important to me? And why is being a member of the Mercy world important to me? And where is there commonality between these 2 answers? The second question asks you to consider what reasons you can give to a survivor to trust you enough to share their experience with you personally, both as a mental health first responder and as a member of the Mercy world, and of course, the commonalities between these 2 sets of traits. Third, the guide asks you to find commonalities between your PFA training about taking a survivor first, listening-based approach, and what your core values say about respecting other people's dignity and autonomy. Fourth, you'll consider the commonalities between the PFA principle of rolling back personal bias and not projecting your own solution on others, with your core values about serving others and showing humility as a member of the Mercy world. And fifth, the one I'm most proud of, WWJD, which if you're familiar with WWJD, stands for what would Jesus do? But since not everyone using this guide may be Christian, I swapped out the J for a they and it worked. So WWJD. So here, think of someone who you consider a role model as a member of the Mercy world. What would they do if they were performing PFA? Think of them and try to model what their behavior would be. So this could be anyone who inspires you. Perhaps someone you're in a working group with, or a sister, associate, partner with a particularly effervescent personality who has a gift for relating to people with mercy and compassion. But for our purposes here, I think an obvious they we can all agree on could be Catherine herself. So if Catherine McCauley was giving psychological first aid to someone, how do you think she would act? Then the guide tells us to focus on these answers, especially the commonalities between your identity and values as a mental health first responder and a member of the Mercy world, and let them guide you as you interact with survivors. Now let's fast forward. You've all helped a lot of survivors. You've provided supportive, effective psychological first aid to them. Now let's move on to our 5 reflection questions. The first of those asks, how do I feel after my interactions with survivors? Name at least 5 emotions. Was my own dignity respected by others and by myself? The second asks you to compare your PFA training that says you should take time for self-care with your core values about self-care that you've developed as a member of the Mercy world, and then of course to find the commonalities between them. The third asks you to consider when you felt you acted more like a mental health first responder and when you felt you acted more like a member of the Mercy world, and then to consider when you felt that you struck the perfect balance between the 2. Fourth, the guide asks you to find commonalities between the ways that you felt you performed your role well as a mental health first responder and the ways you performed your role well as a member of the Mercy world. And last, you'll consider the commonalities between the way that you were challenged as a mental health first responder and as a member of the Mercy world. And then again, the guide asks you to keep these answers at the forefront of your mind so that you can properly care for yourself as a mental health first responder, which can be quite taxing, but also to reflect on how you can improve each time you interact with survivors. Now, looking back on all of these questions, you can see that the strategy here is to help people to connect what they learned in their PFA training with what their values are as a member of the Mercy world, for example. These questions are designed to streamline these 2 identities and have them work together. In this way, these community members can provide effective PFA and reach more people because they are truly doing it from the perspective of their two identities. The mental health first responder identity to provide the effective PFA, and the community member identity to reach more people. And I'd like to end by revisiting where this research can add value to the practice of providing mental health care to disaster survivors. Well, mostly it provides an avenue of access to bring mental health treatment to more communities where it has traditionally been resisted. It's an especially important strategy to respond to disasters that occur in such communities, because in this context, more and more studies show that there is a clear need for swift, effective mental health treatment. And revisiting this question of why it's relevant to the Mercy world, well, we've seen that these questions can be answered from the Mercy perspective because we just done it together. So we know that Mercy values can easily be applied to this context. And for a member of the Mercy world to provide this mental health support to a fellow member of their community would be a way to read the signs of the times and apply Catherine McCauley's vision of Mercy in the 21st century in an innovative, useful way. So finally, I hope that what I've created can be a useful resource to any community trying to rebuild after a disaster, not only buildings and bodies, but also the mental well-being of its